Indomethacin Capsule, extended release, is used to relieve pain, swelling, and joint stiffness caused by arthritis, bursitis, and tendonitis. It helps reduce these symptoms so that you can carry out your daily activities more easily. It is important to note that this medication does not provide quick relief for pain, and should not be used for sudden gout attacks. Indomethacin is classified as a nonsteroidal anti-inflammatory drug, NSAID. If you are dealing with a chronic condition like arthritis, it's a good idea to talk to your doctor about non-drug treatments or using other medications to manage your pain. Remember to also check the warning section for additional information. As for the daily dosage and optimal timing, it's essential to follow your doctor's instructions for the best results. Before you start taking indomethacin, make sure you read the medication guide provided by your pharmacist. It's important to swallow the capsules whole, without crushing or chewing them, and to take it with a full glass of water. Your doctor will usually recommend taking it once or twice daily, either with food, right after meals, or with antacids to prevent stomach upset. Remember not to lie down for at least 10 minutes after taking the medication. The dosage will be based on your medical condition and response to treatment, and it's important to use the lowest effective dose for the shortest possible length of time to minimize side effects. For chronic conditions like arthritis, continue taking it as directed by your doctor. Keep in mind that it may take up to 4 weeks of regular use before you notice the full benefits, and make sure to inform your doctor if your condition worsens. If you experience upset stomach, heartburn, headache, drowsiness, or dizziness, make sure to inform your doctor or pharmacist. It's important to remember that the benefits of this medication outweigh the potential side effects. However, it's essential to monitor your blood pressure regularly while taking this medication, and contact your doctor if it becomes high. Be sure to contact your doctor immediately if you experience any serious side effects such as changes in hearing, mental or mood changes, difficulty swallowing, symptoms of heart failure, signs of kidney problems, unexplained stiff neck, or symptoms of liver damage. In the rare event of a serious allergic reaction, seek medical help immediately. It's important to note that this is not a complete list of possible side effects, so if you experience any other effects, contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch, and if you are in Canada, you can report them to Health Canada at 1-866-234-2345. Indomethacin, an extended-release capsule, is a type of nonsteroidal anti-inflammatory drug that may rarely increase the risk for a heart attack or stroke, especially if taken for a long time. This risk may be greater in older adults or those with heart disease, high blood pressure, or diabetes. It is important to avoid taking this drug right before or after heart bypass surgery. There is also a rare risk of serious bleeding from the stomach or intestines without warning symptoms, especially for older adults. If you experience severe stomach pain, bloody or black stools, or vomit that looks like coffee grounds, seek medical help right away. It is important to talk to your doctor or pharmacist about the risks and benefits of taking indomethacin. They can provide guidance on the best time to take this medication and the appropriate dosage for your specific needs. Before taking indomethacin, make sure to inform your doctor about any allergies you have, especially to aspirin or other NSAIDs, and any other medical conditions, such as asthma, heart disease, high blood pressure, liver disease, or kidney problems. It's important to stay hydrated while taking this medication and to let your doctor know if you experience any changes in urination. Be cautious about dizziness or drowsiness while taking this medication, especially when combined with alcohol or marijuana. It's important to limit alcohol consumption and avoid smoking to reduce the risk of stomach bleeding. Before undergoing surgery, be sure to inform your doctor about all the medications you are taking. This medication may increase sensitivity to the sun, so it's important to limit sun exposure and use sunscreen when outdoors. Older adults and children may be more sensitive to the side effects of this drug, so it's important to discuss the risks and benefits with your doctor. Additionally, women of childbearing age should talk to their doctor about the potential risks of using this medication during pregnancy or while breastfeeding. It's important to be aware of potential drug interactions with indomethacin extended-release capsules. Some medications, such as ACE inhibitors, corticosteroids, and water pills, may interact with this drug and increase the risk of side effects. Additionally, it's important to be cautious when taking other medications that may cause bleeding, as combining them with indomethacin can increase the risk of bleeding. It's important to carefully check the labels of all prescription and non-prescription medications, as some may contain similar ingredients to indomethacin and could potentially increase the risk of side effects. However, if your doctor has instructed you to take low-dose aspirin for heart attack or stroke prevention, it's important to continue taking it unless otherwise directed. Lastly, indomethacin may interfere with certain lab tests, so it's crucial to inform lab personnel and all your doctors that you are taking this medication. Always consult with your doctor or pharmacist for more details and to ensure the safe use of this medication. If you believe someone has taken too much Indomethacin capsule, extended release, and is experiencing severe symptoms like fainting or difficulty breathing, call 911 immediately. Otherwise, contact your local poison control center right away. In the US, you can call 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of an overdose may include severe stomach pain, vomiting that looks like coffee grounds, extreme drowsiness, slow or shallow breathing, confusion, and seizures. Remember to keep this medication out of reach of children and pets to prevent accidental overdose. It's important not to share this medication with others. Your doctor may recommend lab and/or medical tests, such as blood pressure, complete blood count, and liver/kidney function tests, while you are taking this medication. Be sure to keep all medical and lab appointments and consult your doctor for more details. In addition to taking this medication, your doctor may also suggest non-drug treatments for arthritis, such as weight loss if needed, and strengthening and conditioning exercises, which may help improve your flexibility, range of motion, and joint function. Be sure to consult your doctor for specific instructions. If you forget to take a dose of Indomethacin capsule, extended release, take it as soon as you remember. If it's close to the time of your next dose, just skip the missed dose and take your next dose at the usual time. Don't take double the dose to make up for the missed one. Make sure to store this medication at room temperature, away from light and moisture. Keep it out of the bathroom and out of reach of children and pets. When it's expired or no longer needed, be sure to properly dispose of it by consulting your pharmacist or local waste disposal company. And remember, don't flush it down the toilet or pour it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.